Assalamu alaikum and welcome to Youth Matters. Now, on today's show, we are looking at mental health and how it impacts an individual, how it impacts their family, how it impacts a community, and what are the things that we can do to try and support this social challenge that we have in our community. A lot of the times, mental health can be misunderstood, and a lot of the times it's seen as a stigma, a taboo subject that people don't want to talk about. Now, in today's show, we want to discuss and we want to explore why it is that people don't talk about it and what could be the repercussions, the kind of damaging factors if we don't discuss something that is so important. Research shows that 1 in 4 people throughout the course of a year at any given time suffer from some form of a mental problem. So what we want to do is, and that's like, there's 4 people in the studio today. So it could be one of us that at a given time in the year we could actually suffer a mental health problem. Assalamu alaikum. Asko amra show amra khorran manoshik shastor ufre topic mental health. আমরা দেখতাম সাইরান মেন্টাল হেলথ লইয়া মানুষে খেনে মাতইন না একটার কথা মানে কত মানুষের লুকাইন বাট আমরা কমিউনিটির মাঝে মানে একটা হইলো খুব কমন সো আমরা আজকে ডিসকাস করতাম সাইরান এটা খিলা হয় খিলা আমরা কি জিনিস করতাম পারবো যেটা না নিয়ে একটার ওভারকাম করতে পারবো আমরা কত ইয়াং বয় নাই আমরা কত প্যারেন্টস আমরা কমিউনিটি মেম্বার্স মানে তারা ও ই টপিকের উপরে ই ইলনেস লইয়া তারার প্রবলেম হয় বাট কতবেলা তারা ডাক্তারও যাইতা নাই কতবেলা তারা গিয়া মানুষের লগে মাত্তা নাই আর ভিতরে রাখি দিন বাদে একটার বাদে আরো কতটা বড় প্রবলেম হয় সো আজকের শো আমরা একটা ডিসকাস করলাম as always this is a show which is looking at local global national issues affecting the youth so we want you the youth at home to get involved so please the number is on the screen please phone in and tell us your experiences of mental health. Do you know someone who suffers from mental health, a family member, a friend? What are your views? Do you feel that there is enough being done as youths? Is there enough out there for you to be aware of what to do, how to help someone? আপনারা শোকটা আমরা চাই আমরা মা বাপ আমরা ইয়াং ভাই বোনাইতে যে দেখরা আপনারা ঘুরাইয়া আপনারা আমরা খৌকা আপনারা জানেননি কেউ যে মেন্টাল হেলথ লইয়া তারা প্রবলেম হয় তারা কিতা কররা তারা ডাক্তারও যাইরানি আপনার অপিনিয়ন কিতা আপনারা আমরা এই কমিউনিটির মাঝে ইনাফ করনি সাহায্য করবার দায় এই টপিকের কথা ডিসকাস করবার দায় সো প্লিজ আপনার নাম্বার আছে স্ক্রিনও আপনারা করোকা সবলগে শরীর কাউকা আসসালামু আলাইকুম নাজমিন. Thanks for coming on the show. Now, from a social worker's perspective, how would you define mental health?
In terms of how we deal with mental health, a lot of the times we may have information about the parent going for mental health, or sometimes the children experience that mental health from parents, or even the children themselves going through mental health and parents needing support and how to manage that. So we could be the child or the parent. It doesn't discriminate. So that's how we can make contact with mental health.
And joining us on the panel as well, we have Adil and we have Dr. Babar. Adil, tell me, in terms of mental health, are you aware of people within your family, within the school setting, your college that you go to now, who have suffered from mental health? Are you aware of that?
Yeah, I am aware of certain things you see within your family and also within the school. It's almost like a sort of taboo subject. People don't really want to get that across to their parents and etc. And
for amongst the youth.
Yeah.
Okay, so that's a very interesting point that we'll pick up on. And Dr. Babar, from a clinical psychologist perspective, how would you define mental health and the challenges that you face in your profession?
Well, it's a complex subject. From my perspective, mental health is something to do with psychological, emotional, and social well-being, as well as when people they have diagnosable mental health problem. But what is important to consider is mental health is not just about the presence of mental disorder, but the absence of mental disorder, but also emotional well-being and how much people are able to respond to stress in an effective way, interacting with others, a general sense of well-being and happiness, and feeling integrated basically into the community.
Sure. We have, Nazmin, we have a lot of people watching at home, and I think there are a lot of keywords, that are floating around when it comes to mental health. And I think it's very important at the outset that we try and define some of those terms so people watching at home understand when you're giving a response what you're talking about. So to start off with, when we talk about schizophrenia, that's a word that a lot of the time is used when speaking about mental health and people who suffer. How would you define mental health? How would you define schizophrenia?
In terms of schizophrenia, from my definition, I mean, I'm not a mental health expert, but the things that we come across, it's a disorder where you have a bunch of symptoms, so it's like 5 or more symptoms as far as I know, that people may manifest or experience, and it affects their life. So it could be anything from hallucinations to paranoia to depression.
Sure.
And in terms of how it affects them, it could be sleep deprivation, loss of appetite, isolation, and those are the kind of things that people might pick up on. Or, you know, how people might say, oh, they're talking to themselves and things like that. But that's not necessarily they're schizophrenic. Schizophrenic is a very high kind of threshold in terms of being diagnosed with schizophrenia, as far as I know.
Okay. Now, Dr. Barber, is there anything wrong? Some people, you know, if I saw someone on the streets talking to themselves, it could be that maybe they're going to a job interview, they're trying to psych themselves up. So should we jump to conclusion if we see people talking to themselves? I know it's a sign of, it's a symptom of schizophrenia. What do you think? And sometimes it could be misunderstood, right?
I don't think so. I think mental health diagnosis should be done by mental health experts. Although it's a domain where everyone they think they can have an opinion about it, and there is nothing wrong with that. As far as they know, this is not a expert opinion. But I think saying something in the street and putting a label on it, it would be quite simplistic in my view.
Okay, that's interesting. Now, Adil, in terms of in a college setting, is it schizophrenia? Nazmin spoke about some of the symptoms. Do you see that? Do you see that on a daily basis when you go into a college setting or on the streets from a youth perspective?
Not really. It's not things that you can sort of like you see and you can straight away tell that this person is a schizophrenic and stuff like that. But I think people sort of hide it within themselves and they just don't make it known to others. It's not something that you really talk about with others either, unless they are really close friends or relatives.
Now, Nazmin, sometimes you see people who on the streets and they're walking down, they're talking to themselves, and you know sometimes it could be that you know they're going through emotional experiences in their life. A schizophrenic person, someone who suffers from schizophrenia, what are the early signs? What are the early signs that someone would see in a person?
Not necessarily an expert, but I think if someone's very unwell, in terms of somebody who was schizophrenic, there would be a lot of social problems and emotional problems in terms of what they're going through, and it'll be a struggle to generally live their life. So
Sure.
I think in terms of if it is a really big struggle for them, then they need to access help, and the first point of contact is through your general practitioner.
Sure.
So make a GP appointment and go to them and discuss that, because they might feel like they're suffering schizophrenia, they might not, or they may be. So I guess
Okay.
people self-analyse themselves, or even close family and friends noticing different symptoms.
Dr. Barber, are we shooting ourselves in the foot when sometimes we try and diagnose ourselves? So when we try and categorize, when we see certain symptoms in our children or family members, and we try and play the doctor, we try and put our doctor hat on and try and say you're suffering from this or that. What would be, if there are people out there who are watching this show who sometimes jump to those conclusions, what would you say to them?
Interesting question. I think is right to be concerned. But I think making diagnosis or putting label, it can be more problematic, right, and helpful, because basically we jump into conclusion what might be wrong before we really understand the problem. I think the best way is to consult with professionals before really making any labels, because those labels, psychiatric diagnosis is a whole different ball game. It's not as accurate as we see it in physical medicine. It's not to say is not valid, but it's got its own limitation, and it has to be interpreted in its own context.
Thank you. We have a caller on the line who's a mental health patient. Assalamu alaikum.
Hello.
Assalamu alaikum, brother. How would you like to contribute to the discussion?
Hello, assalamu alaikum.
Wa alaikum assalam, bhai khoka.
Am I on live TV?
Yes, you are, bhai.
Okay, bye. Very important topic today. So you've come up with a very good topic. mental health causes a lot of problems. The first thing is to go to the GP. I know a brother who actually been caught staying illegally in UK,
Sure.
being deported previously in the UK due to working illegally. But the problem was he has several aliases. He confused and deter relevant authorities. But the girl he has married is from Swansea. But what they do, they come to the country, and then what they do, they divorce. And recently, he's broken a couple of marriages. So I would say just not go to the GP. You must go to the consular department in Bangladesh, or
Okay.
first thing to do is go to the UK border agency.
Okay. All right. Thank you for your call, brother. So, Nazmin, I think that caller speaks about how someone, possible effects of a very significant experience in their life that could lead to, and the next question I was going to ask is how we define depression. So, what could happen is something significant might happen in your life where it leads to you getting depressed as a person. And from your experiences working with the young people, do you see that? Do you see that experience or an event can lead to depression?
Definitely. It's quite common in terms of not just young people. I mean, I work with from 0 to 18, so in terms of depression, a lot of it manifests when they're a lot older. But sometimes they go through a lot of trauma, the children I work with. So a result of that trauma based on, it could be abuse from a caregiver or somebody outside of that. They do have that depression, low mood, anxiety as well, and all kind of bundled into one. And it manifests into them being isolated, sleep deprivation. It could be self-harm as well, which can be quite common for, and which is a serious risk to young people. So it's definitely common in terms with children.
Adil, when we talk about depression, what kind of depression cases have you come across, in a youth setting what causes a young person to get depressed nowadays?
I think some of the things that may cause problems within a person's life is maybe it could be due to a sort of generation gap between children and their parents. It's because it's sort of like a taboo subject. It's not something that you would tell your mum or your dad. And
say for example, what kind of stories, what kind of cases are you aware of where something, an incident or an event led to someone getting quite depressed who was quite young? Would it be stuff like, if there's a divorce in the family, or if the parents break up, or are there other things that could lead to someone getting depressed?
yeah, of course, there was
Young people.
I know a friend who obviously his parents got divorced when they were younger, and because of that he had no sort of father figure in the family. He just had like an older sister, and it was just him and his older sister. I think because of that, there could be like there's no one to turn to in a way, and it just makes things difficult for him.
Wow, okay, thank you. We've got another caller on the line. Assalamu alaikum, caller.
Thank you.
Brother, how would you like to contribute to the discussion today?
Yes. Another topic I was going to say about mental health is that one brother, he married in Bangladesh, and recently he divorced his wife and got married to the lady's daughter. So that caused a lot of mental distress.
Yeah.
So I just wanted to say, অনেক প্রবলেম হয়ে যায় বর্তমানে পয়লা মারে বিয়া করছে মারে বিয়া কইরা ফুরিরে বিয়া করিচ্ছে.
No, thank you, bhai. I think so. I think, Doctor, the caller raises a very worrying concern that the effect that, say, for example, if our parents do something that leads to causing significant effect to the young person. So, say if a person commits a crime, or say, for example, if they do something that, might be illegal, anything that a parent may do which may cause significant, mental harm to the child. What is your view on that?
Are you kind of thinking if the parents do it, how will it affect their children?
Yes. And could that have
Yeah.
damaging long-term mental
Sure.
effect on the child?
Well, clearly, parents are role models for their children and caregivers at the same time. The way they conduct themselves as couple and wife and husband inside the family and outside the family, and the way they treat the children has a big part in basically conditioning the children in terms of how their well-being is actually promoted or otherwise. So if parents are actually not very attentive or not spending time with children or very much involved in their own issues, either between couples or outside the family, work-related issues, criminality, substance misuse, anything that actually create distance and emotional disconnection can be very harmful.
So you're talking about substance misuse. If there was a situation where parents were constantly arguing in front of children, what kind of mental, pressure, mental stress would that cause on a young person?
I mean, children develop in a very in a context of the family, and if that context is not affectionate and safe, so to speak, it would be harmful. So even when parents argue in front of children, especially the younger the children are, the more harmful it would be. Basically, they threaten the sense of safety in the family, and that cause anxiety, fear, and if it's continuous, that can be even more harmful because it's not just one-off thing. Effect would be very continuous on children.
And Nazmin, that could end up having long-term effects, even say with regards to that person having relationships in the future, because you almost, they might go into their shell possibly. What is your view on that? And, from your experience of dealing with young people, do you find that how our parents behave can have a significant effect on the child, the young person?
Yes, definitely, because I work in child protection, so I work in long-term child protection. A lot of the times it's children who have experiences of, for example, parents arguing in front of them, or even if they're listening to parents arguing, or even parents being violent with each other in front of them. I mean, it has a significant impact on that child's attachment with those parents, like Dr. Babak said, their security, their safety, and it impacts on themselves. So it can impact on their relationships with their peers, in school, how they, because their level of safety in the home is so unsafe. In school, they may play up to get that attention to probably solve their problem. So we do deal with that a lot, that we do have children that are being affected by what their parents are doing.
Adil, have you, without mentioning names, are you aware of young people who, for example, they might have changed their behavior, their attitude as a result of possibly issues in the household? So say, for example, their attainment, their ambition within the school, how they were. Have you come across any students like that?
I have come across those sort of cases. Just it's usually due to all these different pressures being placed upon a person, like in terms of grades and their attainment, also to do with their body appearance, how they maintain themselves, from friends, and also for example, if your parent was to compare you to one of your relatives, it just makes it hard on that person. It's just facing these.
Do you think you've touched upon a really good point? So do you feel that over time can lead to someone, having mental problems because of that pressure? So do you feel that constant pressure of you need to succeed, you need to do well in life, that could have an opposite effect?
Yeah, it could. So there's two types of people that can stem from that. One type of person could take it in a good way and use that to improve themselves and become a better person. Or another type of person could fall into the pressure and just underperform, and it's just a cycle of all these different things being in their lives. And harder.
Where students who might have been high achievers have suddenly just changed without any kind of anything that you're aware of. So, say, for example, a student who was an A-star student who was very successful, and suddenly there was a dip, and, physically and then mentally, you could see a change in them. Yeah. You've seen that quite a lot?
I have seen that going on. It does happen.
And and then, in your experience, have they kind of overcome that? Have you seen that kind of almost like a blip, and have they come back, or has it kind of deteriorated? What's What's been your experience?
My experience was that it just sort of deteriorated and went downhill from that. You know, hopefully that person overcomes his problems and gets through with it.
Okay, so that's really interesting. Now, before we go to break, just to touch upon, in terms of Dr. Babar, young people who from a young age have developed a mental problem, how could it impact them growing up and later on in adult life?
I think we got to be careful when we talk about mental and young children, because a lot of time children's difficulties are is a reflection of something wrong in the environment, not necessarily they have mental health, unless we talk about some severe cases like autism or learning disability, which have some sort of biological factors involved. But normally children behavioral or emotional difficulty somehow is a reflection of something might be going on in the family, like parental discord or poverty.
Sure.
I mean, the things that you mentioned rightly, I mean, in the older age when parents make a lot of comparison, depends how rigid and severe that is really.
Sure.
If that compromises the young person's sense of individuality, in the longer term can have a compromising impact on mental health.
Now, that's all for the first segment. Please do stay with us. And after the break, we will be looking more deeply into some of the challenges that a person who has mental health problems goes through and what we can do. So please stay with us and we will be back very shortly.